Kovaltry Vial is a medication used to control and prevent bleeding episodes in people with low levels of factor VIII, also known as hemophilia A. It is also used in these patients before surgery to prevent bleeding. People with low factor VIII levels are at risk for bleeding longer after an injury or surgery and for bleeding inside the body, especially into the joints and muscles. This product contains a man-made form of factor VIII, also called antihemophilic factor. It is used to temporarily replace the missing factor VIII, a protein, clotting factor, that is normally in the blood, so that the blood can clot and the bleeding can stop. It should be noted that this medication should not be used to treat von Willebrand disease. The daily dosage and optimal timing for taking Kovaltry Vial should be determined by a healthcare professional based on individual needs and medical condition. It is important to follow their instructions carefully for the best results. When using Kovaltry Vial, it is important to follow your doctor's instructions for injection into a vein. The speed of the injection may vary depending on your dose and how your body reacts to the medication. After receiving the initial dose at a treatment center or hospital, some patients may be able to administer the medication at home. If this applies to you, it's crucial to read the patient information leaflet provided by your pharmacist before starting and with each refill. You should also learn the preparation and usage instructions in the product package, as well as how to safely store and dispose of needles and medical supplies. Before combining the medication with the solution, ensure that both are at room temperature if they were refrigerated. After mixing, gently swirl the solution to dissolve the powder, but do not shake it. Check the product visually for particles or discoloration, and do not use it if either is present. Follow the product instructions for immediate use. The dosage of Kovaltry Vial is determined by factors such as your medical condition, age, weight, blood test results, and response to treatment. It's essential to closely follow your doctor's instructions. If your condition does not improve or gets worse, be sure to inform your doctor. Some common side effects of Kovaltry Vial include flushing of the face, headache, nausea, fast heartbeat, burning/redness/irritation at the injection site, fever, and chills. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to note that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. While a severe allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, trouble breathing, or chest discomfort/tightness. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects that are not listed. When taking Kovaltry Vial, it's important to follow the dosage instructions provided by your doctor and take it at the recommended time. If you have any concerns or questions about the medication, don't hesitate to discuss them with your healthcare provider. Before starting Kovaltry Vial, it's important to let your doctor or pharmacist know if you have any allergies, especially to antihemophilic factor, factor VIII, products, polyethylene glycol, PEG, or inactive ingredients like natural rubber/latex that could cause allergic reactions. Also, make sure to tell them about your medical history, especially if you have a certain type of hemophilia, congenital hemophilia A with inhibitors. Some brands of Kovaltry Vial recommend monitoring your heartbeat during treatment. If your heart starts to beat faster, it is recommended to give the medication more slowly or temporarily stop the infusion until your heart rate returns to normal. Be sure to consult your doctor for more details. If you are pregnant, Kovaltry Vial should only be used when clearly needed. Make sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. When taking Kovaltry Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share this with your doctor and pharmacist. It's important to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Kovaltry Vial. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, dial 911 immediately. Otherwise, Contact your local poison control center at 1-800-222-1222 in the US or a provincial poison control center in Canada. It's important to remember not to share your Kovaltry Vial medication with others. Your doctor may also want to monitor your factor VIII levels through lab tests while you are using this medication, so be sure to keep all of your medical and lab appointments. Consult with your doctor for more details on how Kovaltry Vial can help you and the best way to take it. Make sure to follow the dosing schedule given to you by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. When storing Kovaltry Vial, it's important to follow the manufacturer's instructions. Do not freeze the product and keep it away from light. After mixing, make sure to use it within the specified time frame and discard any unused portion. Keep all medications out of reach of children and pets. When it comes to disposing of Kovaltry Vial, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.